Welcome to the Wellness Revolution podcast.
Here's the big question that I always get. So right now I'm part of the Institute of Functional Medicine. I'm a member, and a lot of people find me through the Institute of Functional Medicine. They call up my office. The first thing they say is, do you take and whatever insurance, Aetna, AmeriHealth, Humana, whatever it is. Mm-hmm. You talk about a model that doesn't necessarily always operate inside the health insurance system. Why do you talk about that when, now I understand, and if it's operating outside the system, but a lot of people think, oh, it's just about being greedy. The doctors are greedy. That's what it's all about. Whereas,
let's take a step back.
Step back.
Take a step back and just think about this. In every other type of insurance, we have a really good idea of what insurance should provide, right? If you have your car insurance or house insurance, we buy that insurance under the potential that something catastrophic happens, or the small chance of that happening, and then we get paid for, if that chance of your house burns down or your car burns down or gets stolen, you get a new car or a new house. And we have a very clear understanding. And that's what, medical insurance made sense in the thing is like, if you get an illness, if you get hit by a truck, we're going to pay for your things and it's a small chance. But what happened over time is we realized that, when you start talking about lifestyle diseases, it doesn't really start to make sense. The insurance concept doesn't really start to make sense when you start to realize that you need other things outside of your health insurance to do that. So for instance, if you just relied on anything that insurance paid for to do to your car, you'd never put oil in it, you'd never change the tires, and very quickly the car would break down. But you realize that there's maintenance that has to happen, and you pay cash for that maintenance in order to keep the car running well. Now, the kind of medicine that you're delivering, you have to think of it is that you don't want to, this is one of my favorite phrases, you don't want to build, if you're trying to build a driving school, don't build a car repair shop, right? Because these are not the same thing. And so what I see is the kind of medicine that you're delivering, and this revolution in medicine is how doctors are actually treating health creation. Now, in the first era of this, doctors were just trying things out, and who knows whether it was working. But what we're seeing now is that enough doctors are trying to do this, are practicing functional medicine, that we can see ways to A, make it really work for the doctor, and B, really make it work for the patient. And typically those solutions are outside of the payer system. And when I say payer system, I mean the insurance system. So, and also you have millions of people in America now coming face to face with this thing called a high deductible, where they now realize that they're paying for the first $5,000 or $10,000 of care per year anyway. So you might as well, start to act like a consumer and not just go to a doctor and wait for the bill to come in and see how much it is. Rather go to someone that has really transparent pricing where you can make a judgment. Okay, is this worth $200, $500, $1,000? And typically what we see is a lot of the interventions that our practitioner community are doing are ridiculously valuable because you're offsetting future healthcare costs. The most expensive thing you could really do is to get a lifestyle-driven chronic disease. Like if you get colitis because you ate McDonald's the whole time and you didn't have a healthy diet, you're going to be on Humira, and Humira is $50,000 a year. That's expensive. Functional medicine is not expensive.
Well, but Humira may be covered by the health insurance, and so therefore you don't think it's expensive because someone else is footing the bill.
I mean, Humira is one of the most, I use Humira as an example because it's $300-$400 a month out of pocket, even if you are getting insurance to pay for it. But ultimately that kind of thinking is short-sighted because as long as someone's paying for it, then eventually you're going to pay for it. So, why do your health insurance premiums go up 30% the next year? You're paying for last year's Humira.
Yes, let's not talk about, people don't think about not just the finances, but that they're chronically ill and feeling like crap. And so they're going to the doctor, and it may be free, but it's almost like you get what you pay for, because people don't necessarily ever get well. They keep mounting up disease upon disease upon disease, more misery, and more pills with more side effects. And then they're wondering, why did they break down? So functional medicine and what we're doing with integrative medicine, functional medicine, and the practice style is different. So one thing I mentioned to you before we started is I said, now my clients are mostly remote, and they find that they like video conferencing and talking on the phone, because it's so much more relaxing. And so we can see each other face to face, and people find out, wow, I really like this. I like where I can see you. And they actually like, sometime I'm at home and they see my doggy come in the picture. They like that interaction, but also as we're sitting here interacting, I might be on my computer and say, oh, I want you to learn XYZ ABC. I'm going to send you a handout for that. I explain it all and send it. I don't have to rush away. Or, for instance, we do a video conference, and in one of my programs, I say, not only will you get the video conference recording, I'll have a transcript for you so that you can read what happened, so you don't ever have to say, what did she say, or what happened? You have it all at your fingertips, which is a much higher level of service that allows people to figure out what their style is to getting better, but also allows me to coach them so that we can have more accountability. When something happens in their life, I'm one of the first persons that they'll send information to. I just want to let you know my dog passed away. My sister passed away. I'm having a tough time.
Yeah.
I'll let you know that. And people communicate with me. And so I can support them through these tough times of stress and help keep them healthy so they won't pass away like their sick relative did. So it's completely... it's all encompassing in a different way than it is when you have 7 or 8 minutes in the doctor's office. And the membership style is also wonderful in that, listen, I'm here when you need me. It's already pretty much paid for. It's kind of like car insurance. Instead of paying an insurance company and getting something that doesn't work, you're paying the doctor. So then when you do need a lot of time from me, it's already taken care of, and we don't have to talk about the finances at all. So the memberships are beautiful. Explain, like you encourage doctors to start memberships within their practice. What made you do that?
Well, look, you hit on so many amazing points in that last piece there, like, just the value that you're adding. It's great to speak to someone who's obviously like drinking the Kool-Aid. Look, there are so many things that you said. Look, a typical visit, if I don't understand after I leave, or if I still have questions, I don't really remember what you said. The fact that you really will catalog what happened and make it easy for people to remember what happened is beautiful, because that's a real asset for people. So I think, that's one, just the technology of making it easy. I mean, look, think of the evolution of medicine and just in terms of this. So, the first medicine is, let's just talk about like psychiatry, right? At the beginning of psychiatry, inpatient electrotherapy, and that's it. Then you have inpatient, so now you're in a hospital, right? And you're in a hospital and you're getting acute psychiatric care. Then they have, we should try and make it a little bit hospitable. Now you have outpatient care or clinics where it looks like the psychiatrist's office looks nice, and now you're in a more comfortable environment. You're not in a hospital setting. And now that's just the natural evolution of that, is now telemedicine, where you get to have it in your house. You don't even have to leave the house. And, there are lots of great benefits there. And I agree. I think telemedicine is the future. I think that the majority of health interactions can happen in the most convenient and lowest overhead way, which will help reduce costs for everyone. Just think, like, when you walk into that clinic and it's got like, incredible furnishings, and it's got, wood this and copper that and granite this, you got to realize you're paying for that too, ultimately. If you walk into a hospital and it's got this beautiful atrium, who's paying those bills? and ultimately you realize it's you too. So this kind of low overhead environment's good for me and it's good for you too. So, we encourage the membership part because we're just trying to reimagine a more appropriate economic interaction between a patient and a doctor where the goal is health restoration. I don't know if you've heard of back in China, there was this idea that you had a healthcare system where you paid when you were well and you didn't pay when you were sick because the doctor wasn't doing their job. Well, it's the closest thing that we found to that, where you don't really pay any extra if you're sick, but you pay the same amount all the time, whether you're sick or well. But actually the doctor has the incentive to keep you well because then you're going to pay without coming in. And why would you continue to pay? Because the value that you're getting is so high. And now, now that you have a membership of patients, you can deliver a lot of the stuff that you would deliver to them one-on-one through an email or through a video or through other, lower overhead means. So, I guess one of the things that we've done is to say, okay, let's not always think in terms of how can we adapt the current system to be slightly better, but to say, okay, this was a good system and is a good system for acute disease. So let's use this system for acute disease. However, these set of diseases are not like these at all. And let's build a system that's more appropriate for these diseases. And I think that type of thinking is, big in Silicon Valley and big in, but if you're a doctor, I don't think it's easy to think like this because you've just been trained to do this. And so that's why perhaps it takes someone like me who can just look out and say, okay, these systems are not set up right. Let's see what it would take to do this. And I'm really excited to have people like you in our community trying to work this out because I don't have all the answers, but I do know that you
working it out,
success and building it, and me hearing about that success and me sharing it with these other doctors means that we all move forward more quickly as a result.
Yeah, so one of my goals with people when they come in is to streamline what they're taking. And so besides people taking pharmaceuticals, which most of them, their goal is to get off of them, they're taking so many supplements. So everybody's taking, 10 and 12 supplements that they figured out from Dr. Google and Dr. Oz of here's what I should take and why. And a lot of times it's not right and it's not quality necessarily. So I always tell people, my goal is to help you get off your medicine and streamline what supplements you take. We're going to have a methodical way of figuring it out. And I'm going to save you money. Not only am I going to save you money, now I use full script. I'm going to give you a source where you're going to be able to get higher quality than what you're getting now, and you're going to get it right from your home. And you can always ask me and get my advice as to what do I think about X or Y, because I'm giving you access to thousands of supplements that us practitioners like, not the ones that are in the store that you have no idea what they are. So my goal is to make you feel healthier and to keep more money in your pocket by streamlining your pharmaceuticals. And I don't stop people's medicines. I don't write prescriptions. I say, I want you to go to your doctor, and your doctor will tell you that you're doing so well, we can reduce your medicine. That's my goal. And what happens is some doctors aren't on board necessarily in the beginning because they're like, I don't know anything about that kind of stuff. But when their client goes back and they're doing better, their blood pressure is better, their cholesterol is better, their diabetes is better, their pain is gone, their thyroid's better, what they say to their client automatically is, I don't know what you're doing, but keep doing whatever you're doing because you're doing great.
Yeah, absolutely.
So it's like streamline their whole life so they feel better, but also put more money in their pocket so that they can streamline whatever regimen they're on, because it's a pain taking a bunch of pills. If you don't want to be on a bunch of pharmaceuticals, I don't want you on a bunch of supplements either. So we want to figure out in a methodical way exactly what's right for you and your body and put the highest quality for the lowest cost on the table for you. And that's my goal with people. So
yeah, totally. Well, look, this is a new breed of doctor. Look, you'll start to realize that you were ahead of the curve. But I think there's a yearning in all doctors for this. And so, what you said at the beginning is right. Like, our goal is to build a new medical system that works for everyone and that, makes this kind of care available to everyone. The first phase in that is facilitating doctors like yourself. First of all, doctors to come and learn about this health creation, because it's a new thing and they weren't taught about it in school. Help them get in a position where they can do it every day. And then our next phase is really to connect the supply and demand, right? There's all this demand for this care. The supply is here. It's a bit jumbled because there's all kinds of, some people do take insurance. Some people don't take insurance. Some people have membership. Some people have packages. So we will be, looking to facilitate and make that process a lot easier and allow you to, to focus on just the things that you're really good at. And so I think, we're starting to see that come together. And some exciting things in the future too.
So what's next steps for you? What are you planning that we should look forward to? Because you always got something on the table. We know that.
Yeah. So I've got a few exciting things. So this summer I did a TED talk a couple of years ago in Guernsey, which is a tiny island in between England and France. And they have a very exciting project in the works, which I was sort of helped to start the conversation on, which is, could Guernsey be the first country to hit 100 life expectancy 100, right? Because Guernsey's only 60,000 people. So it's like a small town. So you could, in America, so you could really think that you could get there much quicker with only 60,000 people. And they're already 4 years ahead of America. I think theirs is 82. America's like 77 or 78. And so, they're seventh in the world right now. So we're going to take a team over there, a team of doctors. We're going to do some content, and we're going to, essentially work with the community to to give some of these skills in there and see what we can do to help them grow their life expectancy through all different types of different types of health creation. So that's kind of exciting.
You keep saying community. We have to community. That's a big thing that you're talking about. Why do you keep saying community? What's big about community?
Look, there's a number of reasons. Like, first, it just is, something that's always been in my world. But a couple of years ago at the IFM annual conference, I saw this talk by Dr. George Slavich, and it really changed my whole world forever, because he's a guy who's studying the effects of social isolation and community essentially on health. And what he's seen and what they've done with their research called human social genomics is that the quality and quantity of your social relationships are a bigger predictor of death and disease than what you eat, your smoking, and exercise, which we've commonly thought of like the biggest three things that you can affect your health outcomes. So to give you an example, there's this idea of targeted rejection, where there's an intentional break of a bond, of a social bond. Like maybe you have a divorce, or you get fired from work, or where there's one person gets taken from a social structure. In those times, your risk of depression will go up 21 times, as opposed to 2 times if you just happen to be like in a group that gets fired all at the same time, if it's a targeted rejection.
Wow.
So if it's that big a factor, the next question we have to ask ourselves is, who is going to solve that? Because a hospital is totally incapable of solving that. Pharmaceuticals, totally incapable of solving that. Mm-hmm. And so I think that the integrative medicine of the future, the functional medicine practices of the future, will solve that through the creation of new relationships between patients who want to get themselves well. And so, there's all kinds of ways in which we're seeing this roll out, in person, in practices, in telemedicine groups, in online support groups, in real connections around places in the community, like CrossFit, co-working spaces, gyms, all these kind of places where people actually are, and facilitating relationships in that kind of environment. So I'm very excited to see, how we can be a leader in that conversation, because I really don't think that any other parts of the medical system are well set up to solve for that problem.
Yeah, so just like I was saying, it's great when I'm as close to my clients as I am, because if they disappear or something happens, they reach out to me and then I'm part of their social network. I have a client, somebody who's been my client. I haven't seen him for a while, and I'm like, "Hey, I haven't seen you for a while, and I miss you. Let's go out to dinner." And so, how often would your doctor think about calling you and say, "Hey, let's go out to dinner. I haven't seen you in a long time, and I just want to hear about how you're doing." And so, the luxury of doing medicine like that, so that you have a personal relationship with your practitioner, is the way it should be for everyone. People complain when they walk in, "My doctor's a jerk. They don't care about me. They don't have time for me." A lot of times doctors are just trying to survive, because they don't like having 5 or 7 minutes with people either. But in order for them to be able to get to the end of the day, they got to give you 5 or 7 minutes, or they'll be there all night. And then the people in the waiting room will be yelling and screaming and hollering and complaining. So it's about creating, to me, it's not just a community of people, but what would it have been like? I've been through a divorce. I got depressed. I was laying on the ground thinking I was going to die, with no support network around me. Felt like I was abandoned by my church. So the people who were supposed to be loving and compassionate were exactly the people who turned their back and walked over me at that time. Wow, what a depression. And because I was a doctor, there was really nobody there to rescue me, because you're a doctor. You're good. You got it. So knowing about, I'm also reach out to people when I know there's something going on, because I remember what it felt like myself, but I also know that they have a higher risk of getting sick and all that while these traumas and dramas are going on in their life. And if I can reach out to them and say, "Hey, what do you need? How can I help you?" And so it's the time, having the time to be able to connect with people is what we need more. And I think although clients crave it, doctors crave that too. I like it when my clients say to me, "You're the best doctor I ever had. And the only thing that I've done to touch them is give them a hug." And they say to me, "You're the best doctor I've ever had." Think about how that makes you feel as a practitioner. Nice. So this is about, we need to boost more doctors up in leadership to realize that this is what's going to save America. If we want to save America from what it's going through now, we need more doctors to be boosted up. And instead of investing more in drugs and hospitals, we need to invest more in practices of practitioners who are giving this type of care that's going to keep the community cohesive and well. So I commend you for doing what you're doing. It's wonderful. Keep doing it. Keep in contact with the world, and keep doing TED Talks. It's so wonderful. Thank you so much.
Such a pleasure to be here, and the same to you. Keep going. You know, your example is amazing for your patients, but it's also amazing for all the other doctors who are scared to come over. And they like to see, you know, when they see doctors living their passion and you know, really loving their job. That's the best example that we can give. So, you know, same back to you.
Oh, I love when I'm talking to clients now. I used to sometimes dread going into office, dread it. Yeah. Even though my patients loved me. But now when I'm getting on the phone with people and doing video conferencing, even when I'm in person with them, I enjoy going to see people all the time. It's fun. I'm relaxed. They are getting better results than I've ever seen. So I'm happy that I found this. Before I even knew what functional medicine was, I started doing it, and I'm happy that I found it. So for people like you who get the word out, keep doing it.
Thank you.
James Maskell, Evolution of Medicine. Where do people go to find out more? EvoMed?
Yeah, check out the Functional Forum. It's functionalforum.com. You can see all of our old episodes on our YouTube channel. But if you just Google Functional Forum, you can find that. And then, you know, my book is The Evolution of Medicine. You can get it on Amazon. And, you know, I would love it if, you know, patients could give that book to their doctors. and doctors could give that book to each other. Ask your doctor if the evolution of medicine might be right for them.
Absolutely. James Maskell, Functional Forum, The Evolution of Medicine, your book. Thank you so much for being on The Wellness Revolution.
Thank you for listening to the Wellness Revolution podcast. If you want to hear more on how to bring wellness into your life, visit drveronica.com. See you all next week. Take care.